Welcome back to our channel here at Libra Aesthetics and Wellness for another Wellness Wednesday. Hope you're doing well. So in today's video, we'll be demonstrating an aesthetics consultation, what you can expect when you come in for your first visit with us, how we assess and help to determine what would be beneficial for you. I hope that you have a wonderful week, and please keep watching. Look below for our social media and our other platforms where you can connect with us. Feel free to call our office for a consultation. Thank you. Hello, how are you doing today?
Very well, and
I'm
you?
glad to see you again. Yeah, so I know you had some concerns, and we're just going to do a consultation to go over the concerns and what ways we can help you. So one of the important things I see here is I look at your Fitzpatrick scale, which is a scale that helps me to determine your skin type and how you react to different treatments, especially with light energy and chemical products and actives that we apply to the skin. So I look through here, and this includes your skin assessment, whether like your eye color, your hair color, how your skin reacts to the sun. I see it doesn't react very well. It always blisters and turns red. And we look over your heritage, and using this we can calculate that your score is a 9, which puts you in the Fitzpatrick skin type 2. So that is light skin, and that usually takes pretty good energy. So I can turn up the energy if I use light therapy and lasers, and you respond to certain chemicals and chemical treatments and actives in a certain way. So that's very helpful to know. So I'm looking here, and one of the things you're interested or concerned about today includes, you tell me when we look here in the mirror.
The crow's nest.
Okay. It's a whole nest, right?
Yes.
It's not even crow's feet.
It's a nest.
So the crow's feet, okay.
And then up to the forehead,
the lines.
and then the angry
11 there. Okay.
Yes.
So you really mentioned the classic areas that we can use neurotoxin for. So let's sort of mention what neurotoxin is. It is something that can help to relax the muscles of the face.
They need a lot of relaxing.
So one of the things, so this one here, the one you mentioned with those lines in the forehead, this is a muscle called the frontalis. So what we'll do is we'll use some neurotoxin to paralyze the muscle. How do you want to look? You want to look like completely no movement, or you want to look a little natural?
No movement.
Oh, so she's like, go all the way. So that will tell me use a little more toxin than someone who wants to be more natural. So now you said the angry 11. So bring it together again. So this here is your glabella complex, and it has a couple of muscles. It has the procerus here and also the corrugators, and you can see the muscles is what makes the skin over it form those lines. So we're going to use toxin again in each of the muscle areas to help get soften that as well. So the toxin I'll use today is Javo, and this here, it usually diffuses about a dime around, so that helps me to choose the pattern. So I like to make it individualized. Now you mentioned the crow's nest, the crow's feet. So what we'll have to do here, your muscle around the eye, it's called the orbicularis oculi, and this is the muscle that makes you make those lines. So what we'll do is also put toxin along this muscle here to help relax it. Now I'll do a technique as well where I'll do some baby Botox, which is just a little smaller increments along here, so I can soften the muscles that are here as well.
Okay.
So this will smooth you out here. So that's what I can do here. What other concerns do you have in terms of anti-aging you mentioned?
Just really the fine lines here.
Okay.
And then the forehead. Every time I take a picture, I can
you see those lines and like, let's get those treated.
Yes.
So that's my plan today. Today is a tox day, and I know you mentioned as well the hair, which we can always target some hair removal.
Yes.
So usually it takes, a couple treatments. You've done a few before, so we'll hit the rest of the hair here to get them, because whenever you do hair removal, the hair is in different stages of growth. So later on, some dormant follicles can start growing again, and so we need to hit those.
Okay.
And of course, if you have any pigment and texture issues, like along your nose, the little telangiectasia as we call it, little blood vessels, we can hit that with some IPL to get rid of it. It targets hemoglobin in the skin. You can also do, I'll just mention all the options. You don't have to, just giving you a general consult. for texture on the skin, you can also do microderm. You can also do chemical peel to get rid of the. You can do a photofacial using light energy as well to get rid of the texture. You can do radio frequency to help to tighten up, the tissue along here. So there's options.
Good.
So yeah, so as we go forward, we'll do, with different techniques. But today we'll start with the talks. So we cleansed over and make sure we cleanse again. So get that area nice and clean. And you can actually sit up while we do the treatment.
Okay.
Yes. Unless you feel like you're someone that will pass out on your hate needles.
No.
So I'll calculate your dose based on the concerns, and we come up with a photo using the muscles. So it'll say here what amount of toxin. Now you told me you really want to freeze it. I might add a couple more. Raise it for. I might add a couple more units, especially in those areas, just to really get that frozen look you want.
Okay.
And so we'll start with that. So we're doing 3 areas today. I'm going to start probably with your curls because it's sensitive. I just get them open. Okay. Hope it doesn't sting too much. A little bee sting. Talks me, just give a tiny bit, just a tiny, so we can soften here.
Not bad.
Okay, glad to hear that. Put a little baby talks right here. So well. Next area. Little fella. This is a deeper muscle, so we go deeper with the full 4 there. Procerus and the corrugators. Very nice. This bring them again angry. Yeah, we hit him. Sometimes I give it a little bit in the upper. Okay, fantastic. All right, raise your brows for me. A good 4 units. So I'll give you. This one's pretty active here, so I'll give it a good 3 units here. Extra one here, and then I'll add 2 more. Breathe again. We don't go lateral to the brow line and not too low because I still want activity for your brow so you don't drop the brow. Did that go?
Oh my God, that was quick.
Oh, good. All the areas are done. So the important post-care, we don't want to diffuse the product out of where I put it. So I'll use a little cool I want you to not do anything too hot to make you sweaty and hot and dilate your blood vessels.
Okay.
So that's the whole point of. And I'll bring you back in 2 weeks because if you need, we'll see how the muscles react, and if you need a little more, just to make sure it's symmetric,
Okay.
we'll do that. And that will be on you. All right. Go ahead and put a tiny bit of arnica so you don't bruise. So next time we'll address, the other issues.
Yes.
We have some Arab, we have some laser to do. It's going to be an ongoing process.
Yes.
But again, with anti-aging, I like to talk about the inside, about your diet, your sleep, how you exercise, things like that keep you young as well. Do you take any supplements?
Just the I'm on like a bunch of multivitamins for the gastric bypass.
Oh, that's right, to make sure you're absorbing things like the hormones are important. So at some point you may want to check your hormone levels. Your DHEA is like one of the top part of the hormones, how it goes down the pathway, things like that. So a lot of times arginine and DHEA are good supplements for women as we go through that change, as we get a little older. And of course, healthy fats in the diet also keeps the skin nice and supple.
Avocados?
Yeah. And then we'll talk over a good little skincare regimen for your type of skin. You definitely want to have a good sunscreen. You can certainly do a physical sunscreen, that's with titanium dioxide and things like that, which is a physical sunscreen. You probably want to do a nice vitamin C serum to even out your skin. It's very active when you do it in the day with a sunscreen.
Okay.
So we'll talk about a good regimen for that. A gentle cleanser, of course, and then a nice moisturizer. Hyaluronic acid at night would be good, and something to keep the moisture in your skin.
Okay.
So, great having you today.
Yes,
Hope I'll see you
thank you.
soon, and we'll
Yes.
just keep on this journey.
Yes.
Thank
Absolutely.
you. Okay.